Have you been told by your doctor you have a fatty liver? If so, you're in very good company. About a third of our population, a third of the planet actually, is estimated to have fatty liver. And when you think of fat in your liver, you think, oh, maybe I should eat less fat. It's actually not associated with fat. Now, fatty liver used to be called, used to be associated with alcoholism. So fatty liver would precede what's called cirrhosis of the liver. And so fatty livers were seen in people who were drinking excess alcohol. Then they had to change the name to non-alcoholic fatty liver disease, much in the same way they changed adult diabetes to type 2 diabetes. Why did they change that name? Because adult diabetes was seen in too many children. So we couldn't call it adult anymore. We had to change the name. So we called it type 2. Same thing with fatty liver. We had to change it to non-alcoholic fatty liver disease because so many patients had fatty liver and they were not alcoholics. So we've seen this unfortunate change in how our body is being impinged upon with our diet and lifestyle, and it's certainly not changing for the better. So getting back to you, if you've been told you had a fatty liver, probably your doctor has said, try to improve your diet, don't drink alcohol. I'm sure they mentioned that. Of course, some people say, I don't drink at all, so then there's not much to do there. But there's not a drug for it. So mostly what you're told is, well, we'll watch it. And then they're going to watch it until it gets so bad you would need a liver transplant. Now, that is a terrible shame because this is a reversible condition that if you catch it early enough, like every part of the human body, the liver loves to heal. So what is driving this? It tends to be, there's alcohol, that's still in the picture, but sugar, high fructose foods. I do not mean fruit, fresh fruit, when I'm saying the word fructose, because fresh fruit has a lot of fiber in it, and so that's off the table as something being bad. Fresh fruit is great, but foods that are high in fructose, like high fructose corn sweetener, sugar, highly processed foods, and as I mentioned, alcohol. So even though it's fatty liver, it's being driven by these highly processed foods. A very interesting thing happens that our fat cells have what's called receptors for insulin. Now, insulin is the hormone that causes you to take blood sugar into your cells so you can utilize that as energy. 93% of Americans, huge number, are metabolically imbalanced. So that means they have, by definition, they have either high blood pressure, high triglycerides, they have diabetes, they're overweight. There's, I think, a couple of more factors in there. But 93% of us are metabolically imbalanced. And so where that comes from is the fact a lot diet and lifestyle. So getting back to the fat cells, so they have receptor sites for insulin. What we know is that when we're eating too much processed food, too much sugary foods, our cells, those receptors become resistant to insulin. The best analogy is, Thanksgiving dinner, you've eaten a lot and your mother-in-law comes over and says, have a little more. And you're like, there is no way, get away from me. You have like almost a violent response. Your cells have that same response where they start getting resistant to insulin's message of let me in, I've got more blood sugar to give you. So when those fat cells become insulin resistant, there's this enzyme that starts breaking up the fat cells and releasing the fat that now goes to your liver and overwhelms your liver. So very interesting. But again, what was at that root cause is insulin resistance. What's at the root cause of that? Sugar, alcohol, refined foods, etc. So that's where that's starting. Now, fatty liver itself is a driving force toward heart disease, 3.5 times increased risk, Alzheimer's, cancer, obesity, gallstones, kidney stones, I mentioned cancer, and acid reflux. So for those of you, my channel talks a lot about hiatal hernia syndrome. I'm going to come back to how fatty liver is related to acid reflux and increasing the symptoms associated with hiatal hernia syndrome. Okay, so the other thing that happens when all this fat comes out and overwhelms your liver is supposed to help you detoxify, and it does a lot of, just like 2,000 different actions. When all this fat overwhelms it, what happens is your triglycerides go up, and a type of cholesterol, the worst type of cholesterol, you've heard of the HDLs, those are the good guys, and the LDLs are the bad guys, and then there's the VLDLs. It just means very low density lipoproteins. It's a type of cholesterol, but the VLDLs, like the LDLs, are bad. And so that's what's pushing the heart disease as a result of this whole phenomena. I'm going to check my notes and see what else I wanted to talk about. So with all the processed foods, what we tend to do is get inflammation in our gut, and the process by which we keep our upper bowel cleansed of bad bacteria, that falters because we have so much inflammation. And bad bacteria come into the upper small intestine. That's called SIBO, if you've ever heard of that. So that's, they do the acronym, but it stands for small intestinal bacterial overgrowth. So you get bacteria coming up into your small intestine, and it shouldn't be allowed there. So bile is supposed to, and enzymes are supposed to keep that upper small intestine nice and clean from bacteria. But with all this inflammation and toxicity, that bacteria can now grow and in your small intestine, and it ferments, and those toxic byproducts are putting more stress on your liver. So there's quite a combination of factors coming in here. Let's talk a little bit about acid reflux. So we talk about, well, the stomach is just under your rib cage on the left, and the liver is just kind of its partner parallel on the right. And what can happen with fatty liver is that the liver actually expands. The fat is making it larger, so more increased intra-abdominal pressure. And that pressure can affect the stomach, and the pressure on the stomach is causing, because the stomach's a bag of acid, that pressure, that compression is causing the stomach to then shoot its acid up your esophagus, and that's acid reflux. So those two are interrelated. They're very close anatomically. So when we talk about hiatal hernia syndrome, we talk about increased intra-abdominal pressure. So constipation can do this, a poor diet, having a history of antibiotics. There's a lot of things that can cause the pressure and the inflammation, but so too can fatty liver. And I didn't even realize how much the liver can grow in size with fatty liver, causing this increased pressure. So that was kind of a new epiphany for me, and then I always share my knowledge with you. So what can we do about it? The Mediterranean diet is considered the best approach. Not that other diets wouldn't work, but when we're saying Mediterranean diet, what we're saying is a nice omnivorous diet that's balanced, and it's real food. You know, at the bottom of the synthesis of a Mediterranean diet is it's real food, and it's a nice variety of real food. You know, you have olive oil. We always think of Mediterranean diet and good quality olive oil. Yes, and fish and fruits and vegetables and beans and legumes and fresh fruit, real food, fresh vegetables. We've got our fiber. We're getting our protein from fish. I think they do some other animal proteins as well. But with animal protein in this country, it has so much to do with the quality. You know, how was the animal treated? So I think they have eggs. I think they have a little bit of dairy, but it's that fermented dairy, like a good fermented yogurt. So it's really all about quality. So that's what a Mediterranean diet includes. Now, if you already have fatty liver, in addition to the dietary change and getting rid of the processed foods and all of that, we can help further from laboratory tests so that we can really unburden the body enough that the body, the liver, will start to repair. And that's the beautiful thing about the human body. You keep hitting it with these toxins and it's getting worse and worse and worse, and then you stop hitting it with toxins, and then it starts to breathe again and say, oh, okay, and then give it help, and it starts to repair more and more and more. So we don't need to put up with fatty liver. We certainly don't need to get to the extreme of getting a liver transplant. That's a horrible situation to be in. But fatty liver is not only very common, but we're seeing it in our children. So there's a lot we can do about this, and I wanted to share this information with you. If you would like a consultation with us, we're delighted to do that for you. That's why we're here, is to improve the health of everyone that we can possibly do so for. So reach out, and we'll talk soon.